Welcome back to the training series. This is the second session in our training series. In this session, we will formulate a skeleton of a nursing care plan. We will look into what are the components in the nursing care plan. We will also discuss the importance of documentation and charting in nursing. We will also do a fun activity as well. So let's get into this. When we do that, let's start from the previous session again. Do you remember the video that I showed you?
Yes.
What did you observe in that video? So you saw some people in there. What were those people doing? What were their emotions? What you saw in that video?
They were going about their normal lives,
Yes.
and obviously
Did you see someone crying?
Yeah.
Someone was crying. Someone was
They were
feeling.
experiencing different
They
emotions.
were showing different sort of emotions, right? One
Yeah.
person was feeling numb.
Yeah.
Other person looked a bit excited or relieved, or another person was happy. Another person was just staring into eternity, like
What to do?
he felt helplessness or something.
Yeah.
You can read different emotions in that video, right?
Yeah.
So that is the first and foremost part in a nursing care plan. What we do, we observe, we see, we hear. So we assess the people. That's the first component of a nursing care plan. So if you can take the page where there is a template of a nursing care plan, that's the one. So the first part, as you can see in the nursing, that's the.
Sorry, can I borrow a pen, please? Thank you.
So the first component of the nursing care plan is assessment, right? So we saw the video, we saw the people, and we see different emotions there. You deduct what they feel from what you see or hear, right? So that's the assessment. Sometimes it can be verbal, sometimes it's what you deduct from what you see. So those two assessments are called subjective assessment or objective assessment. Objective is when you see what you see. You see someone crying. You see someone feeling numb. That's the objective part of it. Subjective is when the person tells you, you ask them, how are you? And the person is telling you, I'm feeling a bit indifferent today. I'm feeling a bit sad today. I'm missing my family today. So it's about what they feel. That's the subjective part of it. So the first and foremost one is assessment. What would you think is what's the second one? Who can tell me the second one?
nursing diagnosis.
Nursing diagnosis. So the first one was assessment, and the second one comes nursing diagnosis. So it's a step above the assessment now. So you saw the person. You saw the person was feeling sad or numb. Now you deduct from that. So you find you reach into a diagnosis. We are not talking about medical diagnosis. We are not saying, okay, so that person is feeling sad, he has depression. We are not saying that. We are not doctors, right? We're not learning to become doctors here. So we reach into a nursing diagnosis. So you can say, what you can do is you find someone sad, you can go and look into their medical history and find out what that person is going through. You are allocated a patient, and you're going in there, you can read the patient's history, you can talk to the patient, you can talk to the family members, you can sort of find out an overall idea of what that person is going through. Just for an example, say if a person is diagnosed with a terminally disease and he's feeling sad, and you see that, so you assessed him, you found that he's sad, you're going back, you're reading the history, and you find that he was diagnosed 3 years ago, and then he was having all these treatments, and then 6 months ago he had the final sort of treatment and like a investigation, and found that it's terminal, and there is no other treatment options available. So you're deducting from that, right? This person is sad because he's going through all these scenarios. So that's the nursing diagnosis part of it. You're not diagnosing the disease, but you're diagnosing the overall, you're finding out what's happening in that patient. So that's the nursing diagnosis part of it. What's the third one?
Planning.
Planning. So what we do, you found out this person is sad because he is diagnosed with a terminally ill disease. So then what we do? As a nurse, what can we do now? What do you think we can do now, Anish?
We have to obviously, put in interventions in place. We got to work out what's
So
necessary.
treatment plan.
Exactly.
Yeah.
Exactly. So we are trying to help that. Our goal is to help people, right? So we found something, we deducted from that this is the issue. Now we have to plan our care. We have to plan of how to help that person. We have to set some goals, and long-term goals and short-term goals, and help that person. Okay, so these are the things that we are doing. The final result of my implementation will be this. So you're finding that you can't just heal the person, right? This person is terminally ill. The goal won't be to cure the person. That's not our thing. What we can do, the goal can be to make him comfortable. The goal can be, what else can we make as a nursing goal? What can we do? What can we consider as a nursing goal? So one thing is that we can make the person comfortable. We can make the person if it's a possibility, like say if you're working in a hospice scenario, there are people who can take the person out for outings just for one day, keep him comfortable, make him happy, take him to meet his friends or family, or just for a coffee, or there are support workers who could do that. What else can we do? You can help.
Like managing pain could be another.
That's another thing, yeah. That's another way of making a person comfortable. You can arrange a pet visit if there is something that patient would like to. Arrange a family meeting, anything. You can think about things. That's the implementation though. What we are trying to do here is to plan what's the end result of it. At the end of the implementation, the person is comfortable. So that's a goal. Make him comfortable. Make his mobility, increase his mobility. So those are the things that the outcome of what we are going to do, right? So that's the planning part of it. What comes next? Implementation. So let's go back. Let's make this a step-by-step scenario. So we saw the person sad. We found that the person is terminally ill. Now we are planning of the goals of how to help that person, and at the end we found that this is the end goal. We are trying to make this person comfortable. What can we do? This is what we talked about just before. What can we do to make this person comfortable? Give him pain relief, whatever prescribed by the doctor. Take him out, go for a coffee, pet visits. Those are the implementation part of it, right? Then the last one would be evaluation. We have to, if we can do anything, but unless and until we evaluate what we did, there is no point of it, right? We have to evaluate, we have to find out if the implementation worked out or not. If it worked out, good. How can we make it better? If it didn't work out, okay, so we have to step back now, think about some other goals or some other implementation, and we have to redo the whole thing again. This is what nursing is. We find something, we observe something, we understand the scenario, then we plan our interventions, we plan the goal, plan the outcome, and then we make implementations out of that. We apply what we did, what we know, all our knowledge, all our compassion, all our empathy, put into action, and then we implement it. Or that's called the intervention part of it as well. And then at the end, we evaluate what we did. Did it work? Did it not work? Is there something better that I could have done? So that's the evaluation part of it. Any questions?
No, I think it's pretty straightforward.
Very straightforward.
Okay.
Well
So-
explained.
Yeah. So just an activity for you. If you could take the pictures. There are 3 pictures that I've given. Just bear with me. I'm gonna take this as well. Okay. Perception. It's not like that.
Sounds a bit hard to say.
Is it hard to see?
No, it's easy to see, but we are thinking whether that person is sad or happy.
Okay,
It's a mixture of emotions.
there you go. Okay, let's do one together at first. Do you have the copy of the nursing care plan template with you
Yeah,
as
yeah,
well?
Yeah.
Okay. So the first one, let's have a look at this picture here.
Start.
Let's have a look at this picture here. Can you all see
Yes,
the
yes.
picture?
Yeah.
See?
So the activity here is to look into the picture, observe, think about the nursing care plan components in your mind. Okay? So we are looking at it, we are observing it, we can't obviously hear what she's trying to say. We are just looking at the objective assessment here. What's your perception about her? What is she feeling?
She's happy.
What's her emotions? Yeah.
She
you
looks
can
quite
say-
relaxed.
Yeah,
Very
she looks
casual.
relaxed.
Casual.
I think she's sitting with her friends.
Yeah.
Or
She's probably having like an activity in an aged care home or
Yeah.
maybe with
Yeah.
her friends and family.
yeah,
Yes, she's feeling happy.
Yeah.
She's feeling
Excited.
excited about something. She's part of an activity. So that's the assessment part of it. So you can put that there in the first in the template. If you can
So,
take the
the
nursing
assessment-
template.
Excited.
Yes.
Excited.
What do you,
No, I think
anything that,
I-
that
what
comes
I
to your
feel, yeah.
mind. Yes, it's about what you feel, your perception.
So
About-
first, that's the first.
That's the
The
first one.
first one,
Yes,
yeah.
that's the first one.
Yeah.
Okay, what's the next one? Nursing diagnosis. So what did you understand from that? So you found that the person is smiling. So okay, so the assessment bit is that she's smiling, right? What did you see? Is that the person is smiling or happy? And the nursing diagnosis would be the person is happy. She's happy, right? She's feeling happy. She's feeling happy because she is with her friends or family. That would be the nursing diagnosis. Assessment is what you saw.
see.
There is nothing else in it. There's all you see, what you saw, what you heard. That's the assessment bit. The nursing diagnosis would be she's happy, right? And then, now there is nothing to solve in here. We don't have to go and make her unhappy now. That's not the goal. So what can be the goal in this? Now the next component is planning.
yeah.
What can we do? She's happy, right? There is nothing we have to go and solve here. What can we plan now?
Make more happy.
Make that time valuable, right? We can go and add some activities if if she really wants to.
Yeah.
We
Promote
can
wellness.
exactly. We can get her friends together, do an activity with her.
Yeah.
So just add into that, share her excitement, share her happiness with her friends and family or the staff members if she's in a care home. So share that happiness, make that time valuable. Okay, how do we implement that now?
Plan suitable activities
Lifestyle activities for her.
Yes, lifestyle activity.
which is culturally sensitive and all that kind of thing.
Exactly. hour. That's one thing too. Do you feel like she might be part of a happy hour already from this picture?
Yeah, I think so.
She's
Yeah.
probably part of a happy hour. Happy hour is one of the implementations that aged care homes usually do, right?
Yeah.
That's an implementation. What would be the evaluation part?
He's asking feedback.
Feedback.
Exactly, that's a good way, isn't it? Right and straight, direct, forward way of getting an evaluation is ask the person, how are you feeling today? Did you have a good time? Did you enjoy?
Is there anything else that we need to add
Anything
to improve?
Exactly, you're asking for feedback. So whatever you did that work?
Yeah.
How can we improve it in the future? So that's the evaluation part of it. And she says when she say that yes, I had a good time, you got your evaluation, you got the feedback, right?
Yeah.
So that's an example of how we do it. Can we just do your activity is to go through those pictures there.
So is there an
Three-
order about 1, 2,
Can
3?
we just let's just put 1, 2, and 3.
So 2, 3 and 4.
Yeah, 2, 3, and 4,
So
please.
which is 2, which is 3?
If everyone can put 2
This
in the
lady
same
looks-
picture.
Yeah. we'll
She
put
looks
this
like 2
2.
and
Yeah.
he looks like a 3.
Let's do the
The boy
same
looks
number.
like 3.
This
Okay.
one looks like 4.
The old guy is 4, like he's almost at the end of the line, so towards the end.
Okay.
In that case, he should look like-
Oh.
So will 10 minutes be okay
Yeah.
for
Yeah,
this?
Yeah.
we'll try our best.
Is it almost half an hour? I think it's almost 20 minutes now. It doesn't have to be elaborate. You can just bullet point what you find. Are you able to picture it in your mind now, the components of the care plan?
Yeah.
How did you go?
Yeah, I think it's pretty straightforward.
He completed, but I am not complete.
That's okay. That's all right. Let's just
When you have learning disabilities, so it takes longer sometimes, but that's all. You know, we gotta understand.
let's
So
try and keep
empathy-
this respectful here.
Empathy.
Okay, can we just discuss about the first? Is this your, not the first, but the second one? Did everyone have this as the second
Yeah, we did.
picture?
Yes.
What do you think? What did she hear?
But
Did she
probably,
hear a bad news or a?
possible, she looks very surprised and in disbelief.
Yeah, it
About
doesn't look
something.
like she heard something good.
No.
Did she? She heard
Yeah.
something that unexpected,
Yeah.
a bad news.
She's crying.
She is crying. She can't believe it. She can't.
Yeah.
She is in disbelief, right?
Yeah, that's it.
So what? That's. So you see that and you understand. You go back. You find out. This is an imaginary scenario, obviously. You go back and you find out what's happening with the lady.
You listen her story. Yeah.
Yeah. What do you think happened with her? Just a scenario. She heard. She heard that
Some
her
Had a
blood
bad
test
result.
results came back and it was bad.
Yes. So
What did she hear?
Or maybe a family member.
Maybe she had a
or-
miscarriage or.
She had a miscarriage. Yes. She heard a family member is terminally
ill or
ill.
something like
What
that.
did you think? That
She might have heard something really bad on that day.
Yeah, it can be something that she never thought about
never
before.
thought about,
Yeah,
yes.
it's a disbelief. So, and what's the next part now? Planning. What are we doing for that now?
She probably needs someone to support her, just to
Provide reassurance.
Yes, the
make
plan.
sure and just to
Find
have
Plan
empathy.
is the plan is the outcome.
Yeah.
So we're looking at the goals.
Yeah.
We are making her comfortable.
Comfortable.
or happy.
Provide
Help her get
reassurance.
through
We
this.
may not be able to make her happy,
Yeah.
really,
Offer
but
emotional support.
she feels emotionally stable.
yeah.
That's the goal, right? She feels content or she feels emotionally stable. That's the outcome. That's the goal of what we are about to do in the next step. So that's the plan. What comes next? Now, to reach that goal, to reach that outcome, we have to implement something. So what's the implementation? We sit with her, we talk to
Talk
her,
to her.
we listen to her, we take her for a walk. You know, just a leaning shoulder
Yeah.
to what she
Encourage her to participate in some meaningful activities.
Exactly. Or provide some quiet time. Some people.
Or offer something more in like social worker support or.
Exactly. Yeah. So everyone processes grief in a different way. Right?
Yeah,
Some people
exactly.
would like to talk. Some people would like to just sit down on their own and process it on their
Yeah.
own. So that's the implementation part of it. And then we evaluate. We go back. We look into her and see if she's okay. If she's feeling a bit relieved. You know. So not like crashing down. Is she okay? So that's the evaluation part of it. Then who did you have? Which picture did you have?
The
as
boy.
the second?
The boy.
The boy. What did you think about the boy? What is he feeling?
Oh,
He's
he's
sad.
quiet. He's
He's
quiet.
He's quiet,
He's
he's
sad.
sad.
No expression.
Did
much
anyone
sad.
feel like he's
He's depressed.
afraid? He's
Yeah.
afraid of the future.
Yeah. Yeah.
Oh,
Sort
he's-
of depressed.
He's sad.
He's sad in the moment, he looks sad.
Yes,
Yeah.
he can't understand what's happening at that time.
Yeah.
Yeah, maybe his
Withdrawn.
mom has passed, but he doesn't know. He can't process it. Do you think like that too, or no? Is it just me thinking that way?
Oh, could be, like, you never know, it could be an accident.
Everyone feels, perceives things differently,
Yeah.
isn't it? So you felt like he's
Maybe
feeling
someone,
down.
like,
Yeah, down.
someone said, I'm not going to buy you that toy.
exactly.
Yeah.
It can be just a
Yeah.
little thing
Yeah.
as well. So that's the assessment part of it. You saw him sitting on his own,
Yeah.
not saying much, with a blank sort of expression.
Expressions.
That's the assessment. What is the what's the next one? The nursing diagnosis.
Diagnosis.
What can you deduct from that?
Feeling sad.
No emotion.
The nursing diagnosis can be he's feeling
Depressed.
okay. He's feeling sad because someone said no to him,
Yeah.
right? So you're making it. What's the next steps?
Planning.
Planning.
Planning to make him happy.
Yeah.
Yeah.
What's the implementation? To sit with him, play with him. What's the
Alright.
evaluation?
Maybe give him a
Ask
toy.
him.
See,
Ask him the
obviously you can
feedback.
assess by yourself by if he acts differently, if he's cheerful running around, playing, you know it's effective.
Exactly.
Yeah.
That's a good way to find out if a 10-year-old boy is happy or not,
Yeah.
isn't it? Okay, so the next one, that's okay. You can it's the same way, right?
Yeah.
The third one would be the person feeling happy or content, or he's
He
seeing
looks like
his family
he's in
members.
deep thought. Maybe
Yes.
he's looking about. Maybe he's just remembering all.
So you got the
Yeah.
idea.
Yeah.
You got the idea here. So before we end this session, let's do a activity.
Yeah.
It's a quiz.
Okay. So excited. You're still writing.
Yeah.
Can everyone see this?
Yes.
Nursing care plan
Yeah,
quiz.
yes.
Yep.
This is
Okay. I'll have to read this. Can someone read it for me?
The nurse completes a thorough assessment of a patient and identifies the nursing diagnosis. Which step will the nurse take next in the nursing care plan?
So I'm just asking about the care plan here itself, the different steps of the care plan. The nurse completes a thorough assessment. So the assessment is done. The nurse just did the assessment.
Implementation.
No, plan.
Then of a particular patient and
Okay.
identifies a nursing diagnosis. So she did the assessment
And
she or
find
he,
the
and then she found a nursing diagnosis. Which step comes next?
Planning.
Planning. Planning, ta-da! There you go. Can you read the second question, please,
A
teacher?
patient states, I have a terrible headache. You observe him rubbing his forehead and having facial creases. Which part of nursing care plan is this?
What do you think?
Diagnosis.
Diagnosis.
Assessment.
What do you think, Anish?
I would think it's an assessment.
What do you think?
Diagnosis.
How
Observe him.
You're observing.
Assessment.
It is assessment, right? You're
Yeah.
observing this person rubbing the headache, rubbing his head. You're observing him saying that he has a headache.
Yeah.
So the
That's
observe.
So whatever he's saying and what he's showing is correlated. Like
Yes.
It's,
Yes, it's a subjective and objective
yeah.
assessment, right? So the which part of the nursing care plan is this?
Assessment.
Assessment. Let's see if this is assessment. Ta-da!
It's a bit tricky, but we made it.
Yeah, we got through this.
Okay. Can you read this, Anish, please?
A 10-year-old patient is admitted in medical ward with a diagnosis of pneumonia. What nursing implementation can be used to support the patient? A. Tell the patient that everything will be alright. B. Educate and support to do deep breathing and coughing exercises. C. Tell the parents that they shouldn't have let their son in the rain. D. Suggest the family a medicine that has helped you in the past.
What do you think? What does everyone think?
Hey.
Tell the patient that everything will be alright.
Educate and
How
support to
educate
do
and support?
deep breathing and coughing exercises.
We
Is
are
that-
not. I won't say
I think
we are
B,
not
like-
doctors because
but-
we are diagnosing.
Yes.
If we have to choose between A, B, C, and D, I would go B.
You would go B, educate
Yeah,
and support
yeah.
to do.
As a basic nurse, I would say.
Can everyone here agree that we are not supposed to tell the parents that you shouldn't have let the kid outside in the rain?
That we
No.
already,
Yeah.
yes.
Everyone agrees with
Yes,
that.
yes.
The other answers are correlated, right? Like
Yeah.
you can say one of the main duties of a nurse is to educate and tell the patients this is how things are done or how to help them alleviate the symptoms. So if a patient is admitted with pneumonia, he's having issues with his breathing, and then so we can help them do deep breathing exercises and coughing exercises. There you go. Deep breathing and coughing exercise.
No,
I think that-
actually, okay. Yeah, it's alright.
I agree with you, Norvi, that we definitely have to provide reassurance to them.
Yes.
But saying everything is alright is actually not
Sometimes we
reassuring. It's
don't
valid.
exactly.
What they need is, that's actually not, you have to validate their feelings, but saying everything is actually diminishing their
What if he's not?
emotions.
Yeah.
What if
Maybe
he's not?
People
not
don't want
alright?
to be, when someone comes to you and say, I'm very upset, they don't want to, you don't want to hear, oh, everything's going to be alright.
That's
You
right.
want to You want them to validate and
Okay.
take you seriously.
Exactly. Let's just move on here. Who is reading this? Norwin, can you please read it?
You document that the patient's oxygen saturation has improved from 90% to 96%
In room air.
In
room
air.
air.
Yeah. Audible wheezing not present currently. Which part of nursing care plan is the statement?
Diagnosis.
Yes.
No, it's not
Do
that.
is there anyone with a different answer here?
Diagnosis.
So you're saying, so what's the scenario? You are documenting that a person who had low saturation has gone up. The saturation has gone up. He was having wheezing, but the wheezing is better now.
I think that's also assessment.
Would that be evaluation? If you think about it, the person was having an issue, you did what you're supposed to do, you implemented things,
Yeah.
and then you're evaluating what you did, and it got better from this to this. This issue has gone now. Now he's feeling better, and you can
Yeah, I think
document.
we can say like
that.
evaluation
I would
too.
say, well, yeah, it is a
Yeah.
form of evaluation. You're
Yes.
checking whether it has your intervention has helped.
That's right.
Yeah.
So that's the evaluation. One last one. Do you want to do it again, Jisha?
You are all allocated a patient diagnosis with gout. The patient is having decreased mobility issues. What are the possible steps in planning stage of NCP?
Which is the nursing care plan.
Okay.
Do you know what is gout? Gout is when you have swelling in your joints and it's hard to move. The range of motion
Mobility
decreases.
Oh, okay.
So this person is having gout and he has decreased mobility. So what are the options there?
The patient will start walking by the end of the day. The patient can use the buzzer whenever necessary. Increase the mobility level by end of the day. Educate active and passive mobility exercises.
So let's look into that. Can we, the first one, the patient will start walking by the end of the day. Can we do that? Is that a possible goal?
No.
If he is bedridden, can we possibly say that, yep, this is my goal to make him walk by the end of the day? That's not possible.
No.
So that's a no.
Yeah.
Straight away. The patient can use the buzzer whenever necessary. That's another, that is nothing that we are doing, right? There is nothing to do from our part.
Yeah.
We are just putting all the responsibility onto the patient. If you want it, this is what you have to do.
Yeah.
Increase the mobility level by the end of the day. Would you think that's a good thing?
Yeah, something to work towards.
Yes. The patient might be just able to lift his arm here in the beginning of the day. All we are trying to say is we are moving from 30 degrees to 45 degrees or 90 degrees.
Increase.
That is something that we can work on,
Yeah.
right?
Yeah.
So that's a good answer, I think. Educate active and passive mobility exercises. That what about that? That's a tricky bit. What do you think? Why do you think that answer is wrong?
Because it's not planning, it's actually implementation.
Exactly. So that's not the planning bit, that's the implementation bit.
Yep.
So the answer to this is increase the mobility level by the end of the day. Good job.
Good job.
Well done.
Thank you.
So let's wrap it up. Let's wrap the second session of this training series. Do you have any questions?
No, well explained. It was fun. And
Learning about this.
Yeah, very interactive.
Interesting section.
Thank you.
Thank you.
Thank you for your
no,
time.
you're doing good job.
Teacher, my answer.
No, yes.
Sorry for all of it. Huh? Ini belum lagi